infection, the progression tends to be faster. People that have hepatitis C and also have hepatitis B, or they have hepatitis C and they consume alcohol, the progression seems to be faster because these things, they have synergistic effects, in causing faster, progression of the liver disease. Now, another notable thing about hepatitis C is that not only the liver, it could affect so many organ systems in the body, the blood system, the skin, the kidneys, the eyes, blood vessels. At times we see patients that did not even come because of hepatitis C. Some of them came to the hospital because of a skin disease, some because of a blood disease, some because of a kidney disease. And in the process of investigating them, they are found to have hepatitis C. These kind of people, if the hepatitis C is not treated, such skin disease or blood disease or kidney disease would not even resolve because hepatitis C is the one driving such disease. Now, chronic hepatitis, as I said earlier, is asymptomatic. They show for face, just like they say in HIV. It does not show on the face. So just by mere looking at people, you won't know who has a chronic hepatitis B or C, except, their complications. But from this picture, all the people, shown in this picture, one cannot tell who has hepatitis B, who has hepatitis C, or not. Now, the way to make a diagnosis is just by doing a simple blood test. That's the only way to make a diagnosis. The blood test could just be a rapid test in which you get the result within a few minutes, or it could be a laboratory test in which they take your sample to the lab and the results should be ready also within a few hours. So that's the only way to make a diagnosis. Now, there's treatment for chronic hepatitis B. In medicine, we talk about treatment, we talk about cure. Now, hepatitis B can be treated with antiviral drugs, though there's no cure yet for hepatitis B. But we should also know that not everyone with hepatitis B requires treatment. Certain tests will determine if the infection is active. Active just means that the virus is actively multiplying, and there's some destruction of liver cells. And such people will require antiviral drug treatment. Inactive means that the virus has been inactivated by the immune system, has been suppressed by the person's immune system, and such people do not require antivirals. But the important thing is that they require periodic monitoring, which will help us to determine if it remains inactive or if it becomes active later in future. And at that point in time, they require antiviral drugs. It is important to see a doctor who specializes in liver disease for proper evaluation and treatment, if one tests positive to hepatitis B. And the current treatment regimen is potentially lifelong until a cure is found. We tell people that it's potentially a lifelong disease, a lifelong treatment rather. And there are some few circumstances in which treatment can be stopped. Some people may just be lucky that their immune system is able to eradicate the infection. And this happens just in about 2 to 3% of people per year. So it's also possible that the body may eradicate it, whether on treatment or without treatment. But the important thing is to be evaluated to determine what is needed. Now, hepatitis C can be cured. We have drugs that can completely eradicate and cure hepatitis C. The treatment is usually 8 weeks or 12 weeks, depending on the drugs used. It's also important to see a doctor who specializes in liver disease, for proper evaluation and treatment of hepatitis C. Now, there are some misinformation on hepatitis C treatments. You see people who tested positive to hepatitis B or C, and some people would have told them that they shouldn't eat any form of protein, because it's going to cause more problem for the liver, or they shouldn't eat meat, or they shouldn't eat oil or take palm oil. They should take a lot of sugar cane or carbohydrates, take a lot of sugar, and so on and so forth. All these are fake news as far as we are concerned. We always encourage our patients to take a normal, balanced diet. Having chronic hepatitis does not stop one from eating, any of these things. We always advise a balanced diet. The only advice we give people is to avoid alcohol, avoid herbal drugs, any other thing that we know can cause more damage to the liver or may have a synergistic effect in causing more damage, to the liver. Otherwise, one should take a healthy, balanced diet. Now, when chronic hepatitis is left untreated, the consequences are the liver may become cirrhotic, in which the liver becomes hard, becomes nodular, becomes very stiff, and blood is not able to flow through the liver easily, and the liver too is not able to perform the function as it should. Likewise, such livers may develop liver cancers, and we know that with any cancer, it's usually very difficult to treat. When it's caught at the early stage, it's still possible to have a liver transplantation, for liver cancers. But as I said, in Nigeria, we don't even have a center that can do liver transplantation. Now, when there are complications, this is when people tend to have a lot of symptoms. And when these symptoms occur, it may be a little bit too late, to have any form of curative treatment. People may present with, easy tiredness, feeling unwell. They may have yellow eyes. They may begin to have body itching. Some may have abdominal swelling, or they may have a mass, a swelling in the right upper part of the abdomen where the liver is. And some may begin to lose weight. Then there could be right upper abdominal pain, that's site of the liver. Some may begin to have leg swelling, and some may have bleeding from the digestive tract or from other parts of the body. Part of the function of the liver, we said, was to help in forming blood clots. So when this function is impaired, there could be bleeding, and there are other things that could be complicated from liver cirrhosis that could lead to such bleeding. Well, this is just to show a diagram, showing what patients could present with yellow skin, yellow eyes. Some may become confused, because some of the toxic things that the liver is meant to help to detoxify, the liver is not able to do that when there's liver failure. And those toxic things may get into the brain, cause confusion, may even make some people drowsy, and subsequently unconscious. Some may have dilated veins, what we call spider angioma. Some may begin to lose their body hair, particularly armpit hair, and may also lose lower abdominal, hair, particularly in males. Muscle wasting as evidence of weight loss. Then the blood vessels of the abdomen that are very tiny and we don't see them, they may become bigger and widened. We begin to see these blood vessels in the abdomen. The abdomen may become swollen, filled with fluid, what we call ascites, and the palms may also become reddish. These are all signs, of complications from chronic viral hepatitis. Now, we see some patients coming with this. We can see the diagram on the left upper part of the screen. That's a patient with that's a patient with a liver cancer, and swelling there is so obvious. So we can see the other patient with swollen abdomen and distended abdominal wall veins. These are patients with liver cirrhosis, and liver cancers. At this stage, it's very easy to just make a diagnosis. Unfortunately, at this stage, treatment becomes very difficult because you are not only dealing with the viral hepatitis, you are also dealing with the complications that the patient has come with at this stage. And now, by way of prevention, which is one of the key takeaways in this presentation, we need to enlighten the public. We need to create awareness. And I wish to thank the organizers of the event, for using this forum to create awareness about viral hepatitis. And when we are aware of the infection, we need to avoid stigmatization. Most people that have hepatitis is not their own making. Gone are the days that people think it's because of waywardness that somebody has hepatitis. As we've seen, there's childhood transmission, which one has no control over. Then screening and testing, very important, to know one's status so that one can get treated. Also to get immunization if one tests negative. Then preventive measures, lifestyle modifications, very, very important. So we'll talk about this also. And for those that are negative, vaccination becomes very important. Likewise, for newborn babies, vaccination becomes very important so that they can have lifelong protection against hepatitis B. Now, to enlighten the public, I belong to an NGO called the Enlightenment Initiative of Viral Hepatitis. That is what we love doing, to enlighten the public.
Yeah, Dr. Lukman.
Yes.
Yeah, we have like 10 more minutes for your lecture. Will that be sufficient, or you want us to extend it a bit?
No, it's sufficient.
Okay.
Yeah.
Then before you proceed, for our audience, we'll be taking questions, but we want the questions to be sent on chat. So please, you can start typing in your questions so that you can take them after the lecture. Please go ahead, Doctor.
Okay, then we have days that are dedicated to creating awareness. We have the World Hepatitis Day, which is 20th of July of every year. These are days we dedicate to, creating awareness on viral hepatitis. And of course, we have the World Liver Day. Of course, you can't talk about the liver without talking about viral hepatitis. And that day is on 19th of April. Then we have the Liver Cancer Awareness Month, which is next month, October. This is a month-long, awareness program. And we can't talk about liver cancers, without talking about viral hepatitis. As we said earlier, viral hepatitis is a major cause of liver cancers. And this is us in the Alignment Initiative of Viral Hepatitis, giving health talks, creating awareness about viral hepatitis. And this is something that we love doing and we wish to continue to do. And why should people be tested for hepatitis B? Once you test, it's the only way to know whether you have hepatitis B or C or not. There's no other way to know. As I said, some people may have no symptoms and they have this infection. And treatment is available for hepatitis B. Curative treatment is available for hepatitis C. So the earlier one knows, the better, before any complications. And also to keep the family healthy. Once a member of the family is known to be positive, of course, other family members should get immunization, and the person that is positive should get treated. The vaccine for hepatitis B is safe and effective, in protecting those that never had the infection. Now, the screening test could be done right there in the public. It's just with a needle prick, you could just get the test done, and within a few minutes, you have the results. Or it could be in the laboratory where your blood sample is taken, processed in the lab, and you get your result within 1 or 2 days. Now, as well as preventive measures and lifestyle modification, it is very important to avoid the following risky behaviors: sharing sharp objects and personal effects like razors, clippers, toothbrushes, shaving sticks, and so on. It's important to avoid having multiple sexual partners. And even if you have a single sexual partner, both of you should screen. If any of you is positive, then you should you should seek medical attention. And the partner that is negative should have the immunization for hepatitis B as soon as possible. Then we should avoid getting involved with intravenous drug abuse, so that we don't end up sharing needles with other people. Then by way of vaccination, hepatitis B has an effective vaccine. There are various vaccines from different companies for hepatitis B, which have been found to be very effective. However, hepatitis C has no vaccine yet. But luckily hepatitis C has a cure. So anybody that is infected with hepatitis C can be cured. Those that are not infected with hepatitis B should have the vaccine as soon as possible. Now, when hepatitis B vaccine was discovered, it was even called the anti-cancer vaccine because it prevents hepatitis B, which is the leading cause of liver cancer worldwide. And this vaccine has been available since 1982. It became part of the National Program on Immunization in Nigeria from 2004. Unfortunately, those of us born before 2004, we didn't have this benefit of having it as part of our childhood immunization. But it's not too late. We still test. Once you are negative, get vaccinated. And it stimulates immunity against hepatitis B. It just requires 3 injections. You take the first one, the second one after 1 month, and the third one after 5 months. The first one, then after 1 month, then after 6 months. And this confers immunity. It confers more than 95% protection once you complete the 3 doses of the vaccine. Now, the WHO also has a target to eliminate viral hepatitis by 2030. And this started from 2013, when viral hepatitis was found to be the leading cause of death worldwide, accounting for about 1.46 million deaths. That time it accounted for more deaths than HIV, tuberculosis, or malaria. And it was on the increase since 1990. And more than 90% of this burden was due to sequelae of infection with hepatitis B and C. And in 2014, the World Health Assembly requested that the World Health Organization to examine the feasibility of eliminating hepatitis B and C, worldwide. And there were some elimination goals, defined by the WHO. That's a 90% reduction in the incidence of hepatitis B and C from 2015 to 2030, and a 65% reduction in mortality from hepatitis B and C. That reduction in the death from hepatitis B and C from 2015 to 2030, and to achieve a less than 0.1% prevalence of hepatitis B among children under the age of 5. And that's by ensuring that every newborn baby gets the hepatitis